Should breast implants go above or below the muscle? Deciding whether to place breast implants above or below the muscle is a common question for women considering breast augmentation. The choice depends on many factors like your natural breast tissue, your aesthetic goals, and your lifestyle. Both options have their own benefits and potential drawbacks, so understanding them can help you make an informed decision. Placing implants above the muscle, known as subglandular placement, means the implant sits on top of the chest muscle but underneath the breast tissue. This approach is often recommended for women who already have a good amount of natural breast tissue. Because the implant is covered by the breast tissue, it can look very natural, especially if you want a fuller, lifted appearance. Recovery tends to be quicker and less uncomfortable since the muscle isn't being manipulated. It also doesn't interfere with chest muscle strength or movement, which can be important for active women. Larger implants are easier to accommodate in this position, and the procedure generally takes less time. However, there are some downsides. Women with thinner tissue might notice rippling or implant edges more easily, especially if they have less natural tissue to cover the implant. There is also a slightly higher chance of capsular contracture, which is scar tissue tightening around the implant. Additionally, mammogram interpretation can sometimes be more challenging with implants placed above the muscle. Placing implants below the muscle, called submuscular placement, involves positioning the implant underneath the pectoralis major muscle. This method is often preferred for women with less natural breast tissue or those aiming for a more natural look, especially in the upper part of the breast. Because the muscle covers the implant, it provides more tissue coverage, which helps hide rippling and creates a smooth transition from the chest wall to the breast. This placement is associated with a lower risk of capsular contracture and makes mammogram readings easier. The results tend to look more natural, with a gentle slope in the upper breast. But this approach involves a longer, more complex surgery and a longer recovery period. Some women experience more discomfort after surgery because the muscle is being moved or stretched. There is also a chance of animation deformity, where the implant moves or distorts when the chest muscles contract. Some women might notice a slight decrease in chest muscle strength or experience implant migration over time. In summary, women with enough natural breast tissue often choose above the muscle placement for quicker recovery and a natural look without muscle distortion. Women with less tissue or those wanting a more natural contour may prefer below the muscle placement for better coverage and fewer complications. The best choice is highly individual and should be made after discussing your specific anatomy, goals, and concerns with a board-certified plastic surgeon. Both techniques are safe and effective when performed correctly, and your surgeon can help guide you to the option that best suits your body and lifestyle. Remember, every person is different, and what works for one woman might not be ideal for another. Always seek personalized advice from a qualified medical professional to ensure the best outcome for your breast augmentation journey.